Have the next slide, please. So recently in a national magazine, there was a famous oncologist named Siddhartha Mukherjee, who has written a couple of books about cancer. And in this article, he said that the problem with cancer research is that we've been focusing on the seed instead of the soil. In other words, we've been looking at the tree instead of at the forest. Chemotherapy is often given to prevent metastasis, but only a small fraction of patients will actually metastasize. And the search for cancer genes and metastasis genes has been futile in terms of treatment success. Now, a cancer's metastases depend on local conditions, that is, the soil. So, Dr. Stephen Paget in 1889 published the seed and soil hypothesis. He said that metastasis is the result of interaction between cancer cells and their environment. This idea has been dormant in the mainstream. Knowledge of cancer tissue types and their genetic signature has been considered to be the expert knowledge, but understanding and acknowledgement of how successful natural therapies work has been absent. Now, there's no doubt that several natural therapies, the Gerson program, there are electronic methods of tumor reduction. There are a lot of things that have worked really well without using chemotherapy or radiation. What I'm suggesting is that conventional medicine doesn't treat cancer at all. It attempts to reduce tumors, and the focus on tumor reduction ignores the disease. There are some new emerging theories of cancer development. The one I adhere to is mitochondrial failure. Mitochondrial failure means that the energy production system weakens the body such that it's susceptible to many types of chronic disease, not just cancer alone. And within this hypothesis, the tumor is actually a protective mechanism to sequester the origin, whether it's a toxic origin or an infectious origin of the cancer, to prevent it from affecting the whole body. When it can no longer be contained, then this is what this results in metastasis. So let's see the next slide, please. So how do we understand and evaluate the soil? We're going to focus on cancer at the macroscopic level. Macroscopically, experimental data accumulated over more than a decade supports the concept of a cancer system formed by several geographically separated tissues. But the different areas where the cancer has developed are codependent. So there is an urgent need to zoom out, as opposed to zooming in, to zoom out from the cellular and local tissue view and broaden our perspective by looking at the whole organism. Geographically separated cancer tissues communicate between themselves, forming a system that interacts with the rest of the organism through systemic pathogenic networks. Next slide, please. So the systemic perspective should not be limited solely to clinically stage 4 cancers where there's metastasis, because systemic effects appear when tumors are localized. In fact, from the very beginning, we need to consider cancer to be a disease of the whole body, rather than breast cancer as a disease of the breast, lung cancer as a disease of the lungs, stomach cancer as a disease of the stomach. All of them are a disease of the whole body that, for some reason, is focused in a specific organ. Another recent finding is that the cancer cells can often appear spontaneously in discrete, anatomically distant sites. The traditional view of metastasis is that you have tumor cells that leak out and spread to other parts of the body. But what they found is that as soon as these cancer cells do leak out of the tumor, they're destroyed almost immediately. And also, they don't just land somewhere at random and then sprout and start to grow. There are typical places where the cancer cells show up again, and there are places where they almost never appear. The pancreatic duct is one. the fingers of the bones of the fingers and toes are another. And heart tissue is, of course, very rare. So host factors determine if cancer cells are not eliminated and aggregate into tumors. And these factors also determine if metastasis occurs. So let's look at the next slide. So how can we evaluate the system as a whole? There are 6 factors here that we need to look at: oxidation, inflammation, glycation, immune competence, blood viscosity, and the rate of metabolism, slow metabolism. All of these can be parameters that can be causative factors in what we call the soil, or in natural medicine, it's often called the terrain, deteriorates according to these parameters. So let's look at the first one, which is oxidation. Oxidative stress is a well-known cause of aging. It's been well studied. It damages membranes, proteins, and DNA. Oxidative stress causes aging and degenerative diseases when the body loses its capacity to neutralize and detoxify what are called reactive oxygen species. These are byproducts like free radicals, or if the body loses its capacity to repair the damage that they cause. So let's look at the next slide. How can we examine oxidative stress? I'm going to start below with the conventional. The presence of oxidative stress can be tested by direct measurement of the reactive oxygen species, by measurement of the resulting damage to biomolecules, or detection of antioxidant levels. But the cell has an antioxidant system, and the breakdown of the antioxidant system is one of the causes of oxidative stress damaging the cells. Now, the unconventional methods we're going to look at next: dark field microscopy, the blood clot method, and there's also the free oxygen radical monitor, which is a small, sophisticated photometric device with a chemoluminescence chamber that can measure the quantity of byproducts generated from free radical activity. So let's look at the next slide. The slides that follow are from this book, Cancer Treatment Breakthrough. Dr. Gerasimus uses the dark field microscopy. He uses the form. He also uses the blood clot method. And most importantly, he uses molecular markers. And I would encourage you to read the book, because I don't know about other countries. I know that in the United States, oncologists aren't testing molecular markers. And molecular markers can give an idea of how severe the cancer is, how it's responding to treatment, what types of treatment it's likely to respond to or not. And it's also identified supplements that we'll be talking about today, like BioBran and like curcumin, can be measured with molecular markers and shown to be just as effective as some types of chemotherapy, particularly the cell cycle inhibitors. And of course, if you use BioBran or curcumin, you get no toxic effects. You only get immune system building effects. So let's see the next slide, please. So here's live blood analysis. With the oxidative dried blood test and dark field microscopy, we can look at a freshly drawn blood specimen and evaluate the stage of cancer or the degree of oxidative stress. So these are 2 examples of blood that's in a hypercoagulable condition due to oxidative stress. Let's look at the next slide. Here's a multiple myeloma advanced stage. We can see how the clumping and the blood's almost turning into a solid instead of a liquid. At least the red cells are compromised, so they're not able to bring oxygen to the cells. And so this hypoxia is one of the symptoms, or one of the results of advanced stages of cancer. Now let's see the next slide. This is a normal blood pattern. We can see the erythrocytes, the red blood cells, separate from each other, swimming freely, and they're all shaped more or less the same. They all have the same kind of dish shape or torus shape that they're supposed to have. And so it's the goal of treatment to have blood that looks like this. Let's look at the next slide. Okay, so here are, as it says, agglutination of damaged red blood cells forming a thrombus, a blood clot. Oxidative stress and antioxidant deficiency from chemotherapy lead to bad circulation. So chemotherapy doesn't give us that nice picture that we just saw beforehand. It looks like this. But let's see the next slide. After 34 days of taking RBAC and curcumin, RBAC of course is BioBran, there was a 100% modification with normal-shaped red blood cell membranes from better antioxidant protection, detoxification, oxygen supply, and increased immune defense. So notice that this was still during chemotherapy that this took place. Let's see the next slide, please. Okay, so after oxidative stress, inflammation can be a cause of cancer, or it can also be an effect of cancer, or it can interact with cancer in that inflammatory byproducts for both stages of cancer development, and they promote metastasis. The body treats tumors as wounds, but later the tumors accelerate the inflammatory process and they create this vicious circle. So let's look next at how we can evaluate inflammation. Patients with the lowest levels of inflammation have a much longer survival time. Inflammatory markers include C-reactive protein, serum albumin, and these are the numbers that we want to see, and also COX-2 enzymes. Next slide, please. The Glasgow Prognostic Score was developed by a group of doctors in Glasgow, Scotland. They were puzzled about who lives and who dies because you'd sometimes see very young people at a relatively early stage of cancer dying within a few weeks. And sometimes you would see older patients in their 60s, 70s, or even their 80s living for 3 or 4 years, more or less healthy lives. And so what the doctors proceeded to do was take out thousands of medical records and try to figure out what was going on. So it's an inflammation-based score that they determined. It's calculated by dividing C-reactive protein by serum albumin. If the result is greater than 1, there is some degree of systemic inflammation that should be addressed. And if it's 0 or if it's below 1, then the prognosis is good. So they found that the people that were dying very quickly, sometimes young people at an early stage of cancer had a very high level of inflammation, and they have a Glasgow prognostic score maybe of 6 or 7, very high CRP and low serum albumin. And this seemed to be the determining factor in mortality. So people with the high levels of inflammation would die much more rapidly. Let's see the next slide, please. Glycation. So when you hear this word, think sugar consumption, think low glycemic diet. This is sometimes called the Warburg effect. I'm seeing this appear more and more in the literature because I think it's Otto Warburg back in the 1930s discovered that cancer cells live on sugar. And the reaction of sugars with proteins results in tissue destruction, and that this is a factor. And in fact, this is how cancer sometimes is diagnosed with a PET scan, which is a diagnosis for cancer, is actually showing the glucose consumption by malignant tumors. So the glycation also accelerates oxidation, inflammation, cancer, and premature aging. Not to mention, of course, diabetes, which is now being shown to have a very close link with cancer. So let's see the next slide, please. So how do we evaluate glycation? The hemoglobin A1C test is the most available way to do that. The serum glucose should be below 100, but that's a short-term evaluation. The hemoglobin A1C evaluates the relative blood sugar over a longer period of time, over 4 or 5 weeks. So it kind of averages what the sugar levels are like over a period of time. And let's look at the next slide, please. Immune competence. Immunological research has identified the physiological basis whereby physical and emotional injury can alter neurological, endocrine, and immunological status and set the stage for chronic illness. So a variety of effects on host immunity have been observed, but reduced LAK activity, and particularly natural killer or NK cell activity, appear to be a consistent feature of the immune system response to stress. Now, I'll talk about this some more, but it's important to understand that when someone's under stress, it doesn't necessarily reduce the number of these cells. These are lymphocytes. These are lymphokine-activated killer cells, and natural killer cells are types of lymphocytes. And the number is not reduced. You may have the same number of cells, but they become inert. They stop reacting to stimuli. And their normal function is to destroy normal cells at the end of their life. So when a cell has lived its complete lifespan, it's destroyed by NK cells and removed. If the NK cells don't do this, then the dead cells stay with the living cells and there's congestion. But the NK cells also destroy virus-infected cells and they destroy cancer cells. And they are so sensitive to stress that they're almost a marker for stress. Even though a lot of things happen in the body, it seems that NK cell activity is reduced every time. So let's look at the next slide, please. Now, in this country, the chromium release assay is a test that's commonly used. And in different countries, there are going to be different availability of tests. But if you can find a natural killer cell or an activated T cell profile, these are ways of evaluating the effects of stress on the immune system. And also a cortisol blood test is commonly used, and a cortisol saliva test. And this is, of course, a stress hormone released by the adrenal glands. Higher levels of cortisol would indicate higher levels of stress. It's slower acting than adrenaline. So testing for adrenaline doesn't make sense unless you just got attacked by a saber-toothed tiger and then it'll go up for a few hours. But cortisol levels with chronic stress will stay elevated over a period of time. So next, let's look at the next slide. Blood viscosity. So this is important. I want to read some of this. Cancer is associated with a state of hypercoagulability, and this is something that's being researched more recently. I think it's been known for a long time, but the relationship with blood clot formation in cancer and hyperviscosity has been under the research microscope lately. And proagulant factors such as tissue factor, which is released by malignant tissue, as well as by inflammation-driven activation of different types of cells, create an adhesion so that the prothrombotic properties of these cells are enhanced. Tissue factor is considered to be the major molecular driver of cancer-associated coagulopathy and thromboembolic disorders. This all just means that tissue factor is causing blood clots. Now, tumor cells are protected by thick blood clots in many cases, which shield them from the immune system. The immune system literally doesn't see the tumor or even know that it's there because it's being shielded by a blood clot. And sometimes the tumor cells also have surface antigens that pretend that the tumor is normal tissue so that the immune system will ignore it and just pass by. So if these surface antigens can be scratched away, or if the blood clot can be eaten away, then the immune system can more effectively take care of the tumor. And this is done with proteolytic enzymes. which we'll talk about more later when we start to talk about the treatment approach. So plasma viscosity is highly affected by hydration, plasma proteins, and especially high molecular weight proteins like immunoglobulins and fibrinogen. There's also a significant link between fibrin and chronic inflammation. So where there's inflammation, there's oxidative stress. So glycation, inflammation, oxidative stress, and blood viscosity are all related to each other. Increased oxidation results in blood coagulation. We all know that when you cut your finger, the exposure to oxygen creates a clot. But if there's increased exposure to oxygen inside the body, inside the blood vessels, coagulation will occur. And this is an abnormal condition that leads to oxidative stress. So let's look at the next slide now. How do we evaluate blood viscosity? In addition to tissue factor, recommended blood tests should include a complete blood count with platelets, fibrinogen, and D-dimer to monitor blood viscosity. Tests for inflammation should include C-reactive protein, erythrocyte sedimentation rate, and serum albumin. D-dimer has become a focus of interest in the COVID age because people who have long COVID, people who have been vaccinated for COVID, often have elevated D-dimer levels. And other markers for blood viscosity will come down after a few days, but the D-dimer levels tend to stay elevated for a longer period of time, which indicates that there is some kind of ongoing, perhaps microclot formation activity. So that's another one to look at if you're working with people who have had COVID or have been vaccinated, which is just about everyone these days. And let's see the next slide. Slow metabolism. Now, cancer affects mostly, it's in connective tissue and it's in organs, so it's buried fairly deeply. And if we want to remove malignant cells, if we want to clear out the cancer, if the metabolism is too low, there's too much stagnation and the body isn't able to eliminate it. Even if with conventional treatments, chemotherapy, radiation, if there's tumor breakdown, where is it going to go? It's got to be eliminated. In order to be eliminated, there has to be a cell turnover rate. There has to be an efficient metabolism for that to be to take place. So it has to be energetic enough to eliminate toxic accumulation and activate the extracellular matrix. Individuals with higher standard metabolic rate have increased erythrocyte turnover, which is a mechanism of damage removal. And as I mentioned before, there's an emerging theory of cancer development called mitochondrial failure theory. According to this theory, with age, mitochondria, and for those of you who are not medical professionals, the mitochondria is the part of the cell where energy is produced. It's kind of like the battery of the cell. And ATP, or adenosine triphosphate, hydrolysis of the phosphate bonds, is the chemical process that takes place led by the mitochondria, which produces the body's energy. Now, both thyroid hormone T3 and coenzyme Q10 directly activate mitochondrial activity. In fact, when the T3 hormone penetrates the cell, that's where it goes. Mitochondria become dysfunctional if they accumulate damage from oxidation, and they're a natural candidate as a direct target for the effects of thyroid hormones. So let's look at how we evaluate this. Thyroid activity is the main testing strategy to evaluate metabolism. Now, the old-fashioned way, before they had the thyroid blood tests, was to do the basal body temperature, which is to take a thermometer, place it under the arm before getting out of bed first thing in the morning, and the normal body temperature is 97.6 degrees Fahrenheit. Sorry about the I don't know what the centigrade is, but it's 1 degree Fahrenheit cooler, the normal temperature under the arm. And if it's much below that, that would be considered to be hypothyroidism. Also, a sluggish Achilles tendon reflex was a sign of hypothyroidism or an excessively high cholesterol. So today, in clinical medicine, TSH is measured as the primary indication of thyroid function. But TSH is considered strictly within its intrathyroid activity of stimulation of thyroxine, that is, merely as a barometer of thyroid function. But serum TSH is not a sufficient indicator of the efficiency of thyroid regulation and metabolism, because TSH does not always stimulate the thyroid. It has other activities. It, for example, stimulates the production of proteolytic enzymes in the pancreas. And lymph nodes are very rich in TSH receptors. So if TSH is high or low, we really don't know where it is. We just know what's in the blood. We don't know what's in the lymph nodes. We don't know if it's interacting with the pancreas or if it has any other extra thyroid activities. And this is why, and if many of you are clinicians, I'm sure you've seen this, patients with classic hypothyroid symptoms, cold hands and feet, losing hair at the temples, exhausted during the day, agitated and can't sleep at night, tightness in the neck and shoulders, and depression. And so often we see these when the thyroid blood signs are completely normal. And I've had arguments with colleagues about patients saying, look, these are textbook low thyroid signs. They say, no, the blood test says that it's normal. Well, we shouldn't depend on blood tests that much anyway, but particularly not this one. If the TSH is way out of range, of course, that's a red flag. And there probably is something with the thyroid. But too often we get false negatives. So let's look at the next slide. This is the thyroid index. It was developed by doctors in France who were the authors of something called endobiogeny. And it expresses the metabolic activity of the thyroid at the cellular level. In other words, it's not a thyroid test. It's not a test of how much hormone is in the blood. It's a test of what's going on at the cellular level. And it's calculated by dividing lactate dehydrogenase, or LDH, by a creatine phosphokinase. In hypothyroidism, both LDH and CPK levels are elevated compared to normal controls. But the more severe the thyroid disease, the greater the rise in CPK relative to LDH. Let's look at the next one, please. So, other tests to evaluate progress. What can we tell just from the CBC? A lot of times we have patients that we don't know if they have cancer or not, or we have a cancer patient and we don't have tumor marker tests available, or they haven't been done yet. But here's some warning signs: elevated white blood cells, elevated platelets, low hemoglobin, high neutrophil to lymphocyte ratio. The normal range should be between 1 and 2, but this is an important finding. A high neutrophil to lymphocyte ratio predicts poor outcome in some types of cancer, especially lung, pancreatic, and colorectal. And a high neutrophil count suggests a neoplastic process somewhere in the body. The lymphocyte count is also important, and it's a sum of all three sets of lymphocytes: natural killer cells, T cells, and B cells. And NK cells are part of the innate immune system. They survey and directly attack viruses and tumors. The lower the lymphocyte count, the greater the cortisol activity. They're inversely proportional. So if the lymphocyte count is low, that could be an indication that there's a higher amount of circulating cortisol. Also, higher cortisol lowers the eosinophil count. And the lower the circulating cortisol activity, the higher the eosinophil count. So these are also inversely proportional with cortisol and can be construed as signs of chronic stress. Next slide, please. Other tests: hyperglycemia. If the fasting glucose is high, that's a higher risk. And if it's in a cancer patient, it needs to be brought down, because if we believe the Warburg effect, the more sugar available, the more cancer growth available, and more inflammation as well. If the glycemic level is high, that's like pouring kerosene on a fire if there's inflammation in the body. High ferritin levels are significantly associated with reduced survival time, and low levels of vitamin D are associated with various forms of cancer, also poor prognosis and more aggressive disease. This has been especially researched with breast cancer patients. And then last is one that's not frequently done, but serum osteocalcin is directly correlated with tumor growth in both hormone-independent and hormone-dependent tumors. TSH levels vary inversely with serum osteocalcin levels, and together they affect the metabolic activity of estrogens. And estrogen activity can also lead to tumor progression, tumor development. Some tumors are estrogen dependent, and estrogen also promotes inflammation. So the estrogen index would be TSH divided by osteocalcin. Next slide, please. Back to lactate dehydrogenase and creatine phosphokinase. Creatine phosphokinase sometimes is just called creatine kinase. Not to be confused with creatinine, which is important for understanding kidney function. This is creatine kinase, and they can be elevated tenfold or more during metastasis. So watching them is important. Even if the ratio is normal, but the levels are elevated, they need to be evaluated individually and in relationship to each other as determinants of cellular energy production. So to summarize that, the ratio of LDH to CPK evaluates the final functional achievement of thyroid hormones in regulating the rate of metabolic activity of the cell. It doesn't tell us if there's enough thyroid hormone or too much thyroid hormone. It just tells us what it's actually doing in the cell. Okay, next slide, please. Inflammation markers. We already talked about the Glasgow prognostic score, but also the albumin to globulin ratio is important. A ratio of less than 1.66 is a risk factor for cancer incidence and mortality. And the systemic immune inflammation index is another one that's calculated. So, you know, I find that the Glasgow prognostic score is enough in most cases. It's fairly unambiguous, and CRP is very available now. It used to be hard to get a C-reactive protein test, but now they're readily available, and serum albumin is usually in a metabolic activity panel. So it's fast and easy to figure that out. And next slide, please. So we're done with the real technical part of it about blood testing, and I hope, and since this is being recorded, if you need to review it, the information should be available later. But I want to talk next about the healing process. What do we do about all this? So diet, of course, I think most people agree that this is important. But, you know, back in the 1980s, you know, when I was starting my practice, doctors, oncologists completely ignored diet. They said, this is not important. Oh, well, we have the cancer diet and we give people cans of nutrients and you know, we tell them to, you know, eat a balanced diet, you know, the 7 basic food groups. And this is ignoring a lot of research that was already available about the effects of diet and different supplements and herbs on cancer. Next is detoxification. Detoxification is important for protecting liver function. And liver function is important not only for healing, but for well-being, for emotional stability, for hormone regulation, for quality of life. It's very important to detoxify as much as possible. Next are supplements. And supplements are necessary. I feel that there's no diet that's going to be perfect enough that anyone can manage easily. We hear stories of people that did brown rice diets, or people who ate nothing but beets for a year and cured deeply entrenched cancers. I'm sure that's probably true, but very, very few people are going to be able to carry out an efficient diet regimen. And besides, if we use supplements, the ones that I'm going to recommend to you are really food-based. And because of their food, they could be considered a part of the diet. The next item is lifestyle. Lifestyle, in this case, well, in my book, The Whole Body Workbook for Cancer, the lifestyle chapter is about looking at what kind of cosmetics you're using, looking at your work environment. Is there a toxicity in your work environment? Look at what kind of chemicals are in your garage, what kind of paint you're using when you paint a room or something. All these things need to be looked at because there are carcinogenic chemicals that are ubiquitous, that are everywhere in the environment, work environments, and home environments, and in consumer products. The next component is exercise, and I'm going to talk about exercise, supplements, and diet. And the next two, emotional healing and psychospiritual healing, are very important. I'm not going to be talking about them as much. Emotional healing is buried trauma, and we'll talk a little bit about that. Psychospiritual healing means that it's important for people with cancer who are lost and afraid and terrified and not sure what kind of decisions to make. It's important for them to have an understanding of, why do you want to live? What do you want to do with your life? And how can you focus your attention on something positive that's going to be a part of your life? And I think that can help with a positive outcome, regardless of what kind of treatment is used. So let's look at the next slide, please. The microbiome, another key component of the global inflammation network, is gut microbiota. And skipping down, it's germ-free or antibiotic-treated animals don't respond very well to chemotherapy. Chemotherapy patients have a damaged microbiome, and this is another reason why there are poor outcomes with using extremely poisonous substances just to get rid of tumors, which may not even be affecting the underlying disease of the tumors at all. So there's a codependent relationship between the immune system and the gut microbiome. In fact, the gut microbiome can be considered to be an important part of the immune system. So let's look at the next slide. The microbiome affects every system of the body: the brain, the immune system, antibiotics, non-organic foods, chemotherapy. All of these have an adverse effect and promote the proliferation of pathogenic microbes. If we have a good diet, then the friendly bacteria, the probiotics, thrive and grow, and the pathological ones start to die out. Let's look at the next slide. In Japan, breast, colon, and prostate cancer are 7 to 60 times higher in the US than in Japan. Just as many microtumors are found in the prostates of Japanese men who die before the age of 50 from causes other than cancer. But something in their lifestyle prevents these microtumors from developing into cancer. So you have in Japan and in the US, men are growing the same number of prostate microtumors, but in the US, 7 to 60 times higher actual cancer development. So why is this? Let's look at the next slide. The highest life expectancy in the world is in Japan. Both sexes, life expectancy 83.7. Let's look at the next slide. The Japanese diet. This is the reason. Let's go to the next slide. This is an important factor right here, Japanese rice bran pickles, because they're filled with probiotics and they're full of enzymes. We need the probiotics for the microbiome. We need the enzymes to keep inflammation down. So let's look at the next slide. To boil it all down, miso, natto, skemono, which are those pickles we just saw, green tea, and iodine from marine algae, especially kombu, nori, and wakame. These are things that most Japanese people have at least some of this every day. EGCG, which is a catechin found in green tea, has been identified as an agent which inhibits LDH activity in normal and low oxygen environments by its improving oxygen production, in short. This can deprive cancer cells of their preferred fuel, glucose, and metabolites, including lactate, that produces a favorable environment for malignant proliferation, growth, and progression. So, at least when I lived in Japan, had green tea every day, had miso every day. Most days had some type of seaweed. And even if you just had a bowl of noodles, you probably had kombu in the stock. People were speculating, oh, well, why do the Japanese have a lower cancer rate with breast and prostate cancer? It must be the tofu. It's not the tofu. Tofu is estrogen-like, for one thing. And tofu isn't something that people eat large amounts of every day. But seaweed, which is rich in iodine, that's a very important factor in supporting the thyroid. And there are a lot of tissues, like breast tissue, needs a lot of iodine. And if there's sufficient iodine in the diet, then that alone would be a factor that would reduce breast cancer incidence, in my opinion. So the next slide, please. Diet and cancer have been studied more lately. Things have changed a lot. I want to talk about each of these briefly. First of all is the Gerson program. Let's go to the next slide. And there's some basic principles here. Organic foods, live foods, anti-inflammatory foods like green tea, like turmeric, stocks, which are rich in minerals, and having a light evening meal. In other words, not eating heavy food like meat and that type of thing late at night when it's not going to be properly digested. Let's look at the next slide. Here's some foods that prevent and fight cancer: green tea, ginger, seaweeds, cabbage, the sulfur-containing vegetables, garlic and onions, which are sulfur-containing, celery, parsley, soy, as long as it's fermented soy. The tofu, for example, is not fermented, and it has those estrogenic properties. Blueberries, raspberries, pomegranate, cultured shiitake, and cultured wheat germ. Let's see the next slide. So the Gerson program was developed by a German doctor who was mainly treating food allergies and tuberculosis. He treated the famous Dr. Albert Schweitzer, who was a Nobel Peace Prize winner back in the 30s for tuberculosis. And Albert Schweitzer said, Dr. Gerson is the greatest doctor of my generation. He had to leave Nazi Germany and came to America, and at that time, he began seeing a lot of cancer patients, and he began modifying it. The basic principles, he says, are, number one, to support thyroid function so that you can throw off the disease. Number two, regenerate the liver so that it can detoxify the connective tissue layer of the body. And number three, use pancreatin or proteolytic enzymes to help bring inflammation down and to help reduce tumors. So these are the main elements that are in the Gerson program. It's mostly a vegetarian diet, but raw liver, calf's liver is used, and whey protein is also used. In the original program, something called quark, which is a type of fermented cottage cheese, was used. But for those of you who have cancer patients who are anemic, whey protein and raw liver can be very helpful in bringing up the red blood cell level. Let's look at the next slide, please. The Mediterranean diet is famous for treating many diseases, and it's lots of vegetables, legumes, fresh fruit, nuts and seeds, a little bit of wine, extra virgin olive oil, and a little bit of fish, and a little bit, but not very much, dairy. And according to research, the Mediterranean diet reduces the risk of gastric cancer, colorectal cancer, liver cancer, and breast cancer, but not perhaps quite as useful with prostate, esophageal, cancers of the head and neck, pancreatic, and hematological cancers. So even though I think there hasn't been adequate research, here are some guidelines that we can look at for these types of digestive cancers and breast cancer. And the next slide, please. The ketogenic diet has become used a lot now because it takes glucose, it takes sugar out of the diet so that there's more protein. And this is the Warburg effect, that the cancer cells have a higher uptake of glucose and they don't get as much in this diet. So it starves the cancer cells of their main energy source. And so in the human studies, 24 studies showed 41% showed an anti-tumor effect, 20% no effect, 80% not very clear, and 4% actually promoted tumor growth. And in 2020, there was a review of 13 studies that there was a benefit on some types of cancer, but only one was a randomized controlled clinical trial. So let's look at the next slide, please. So the benefits are that it's safe and it's easy to do. People are familiar with it. People like eating meat. People don't like being told they have to go on a vegetarian diet. But some of the adverse effects are significant. Acidosis, hypoglycemia, gastrointestinal distress, and in my opinion, one of the main risks of the ketogenic diet is to liver function, because it's really easy, especially if you're an American or perhaps a European who's used to eating meat every day. It's easy to eat too much and cause liver congestion, and compromising the liver function is probably why the ketogenic diet actually advanced cancer in 4% of the cases it was studied. There's also dehydration, lethargy, and fatigue. People with cancer, especially getting chemotherapy or radiation, should stay well hydrated. So let's look at the next diet, which is the whole food, plant-based, low-fat diet. And this takes out saturated fat, and which is associated with an increased risk of many types of cancer. And it's a whole food, plant-based diet. It's antioxidant rich. So the strategy here is to minimize saturated fats. This unburdens the liver and is rich in antioxidants. And some research has demonstrated that this diet may suppress the growth of certain cancer cells. So there's nothing conclusive that there's an ideal cancer diet. I think it's important to keep watching the literature, because I think it'll become more clear which types of cancer should adhere to which types of diet. So let's look at the next slide. Intermittent fasting, I recommend. Intermittent fasting to most people means having a set 8-hour period of eating and then 16 hours with no food. But in the second paragraph, it says a pattern of completely fasting one day and eating normally the next. I think this is more what I would consider intermittent fasting. And as one detoxifies and adapts to it, even taking 2 days off for food and eating meals 5 days a week could be a survival strategy, even with people with an active cancer, living longer, having a better quality of life, and also a longer survival time, and perhaps a better outcome with treatments. And it can also head off obesity, which is a proven cancer risk. Let's look at the next slide. The benefits of fasting in patients with cancer are improvements in microbiome, suppression of blood glucose, insulin, and IGF-1, slows tumor growth rates, initiates cancer autophagy, which is apoptosis, promotes regeneration. And fasting around chemotherapy, short-term starvation sensitizes cancer cells to the effects of chemotherapy while protecting the healthy cells from toxicity. So healthy cells, upon starvation, upregulate protective and antioxidant capacities. Our cancer cells are unable to do that, and they're more vulnerable. Let's see the next slide, please. Supplements. Different kinds of supplements are nutrients, immune boosters, support for energy production, proteolytic enzymes, antioxidants, and anti-inflammatory supplements. Among these, BioBran is a nutrient, it's a probiotic, it's an immune booster, it's anti-inflammatory, and it's antioxidant. And it doesn't directly produce energy the way you would with thyroid or ginseng or herbs like that, but I think it is supportive for energy production. Let's look at the next slide. RBAC, BioBran, maintains a strong immune system. It increases T cell and B cell proliferation, even in cancer patients. It increases level of helper cell, cytotoxic T cells, and balances the ratio of CD8 suppressor to CD4 helper cells. It activates macrophages, it activates dendritic cells, and it activates natural killer cells. And this is very important because there's some indications and even some animal studies that show that RBAC reduces stress. And it may reduce stress because it increases the natural killer cell activity, or there may be other mechanisms involved. Let's look at the next slide. It's an immune modulator, which means that it will do what the immune system wants to do, not impose a new condition on it. So in the case of cancer, it's been shown that tumor necrosis factor alpha is upregulated. But in a case of inflammation like rheumatoid arthritis, if tumor necrosis factor alpha is elevated, then using BioBran will lower it. So will it raise it? Will it lower it? It depends on what the immune system needs. That's what immune modulation means. Let's see the next slide. It also benefits bone marrow in B-cell cancers. Now, protecting the bone marrow is extremely important because this is why people die from chemotherapy. The white cell count gets too low and they get an infection and they die. Or the red cell count gets too low and they're too low energy to throw off the disease. Their vitality level is too low. And so protecting the bone marrow protects the ability of the body to continue to produce normal levels of red and white blood cells. Next slide, please. Let's see, I need to explain this because this is the only slide I have. This is a mouse study that showed the tumor inhibitory effects of BioBran. They took 2 sets of mice, a control set and a BioBran set. And they, on the 8th day of the study, they began using the BioBran. And immediately the tumor growth began to slow down in the BioBran group. And this is the 35th day. On the 35th day, you could see that the tumor cell is about half the size of the control where there was no treatment with BioBran. So the tumor volume was decreased, survival was increased, and this was studied, I think, in, well, I don't know, I think this is studied in Europe or in Israel. Let's look at the next slide. Then in human study, this is an important study because it's the effect of BioBran on hepatocellular carcinoma. Now, this study is particularly interesting because it significantly increased the survival rate and the survival time. The higher survival rate, 35% compared to 6.7% for the control group in the second year. In the first year, it was less noticeable, but by the second year, quite noticeable. And an overall reduction of tumor volume by 36% compared to almost no change in the size of the tumor in the controls. Now, this is in conjunction with, in many cases, with conventional therapies. And I think in some cases it was used without conventional therapies. But the important thing here is, and I don't know if you've noticed this, but a lot of human clinical trials for cancer are very short. This one was for 3 years. They were using this supplement, and in fact, in one study, because of humanitarian concerns, the BioBran group was doing so much better that they decided to give it to the control group because it was unethical to continue not giving it to people when it was showing to be so beneficial. But the reason most human clinical cancer studies are short is because things go bad very quickly. You have your brand new chemical you've developed, for tumor reduction, and it works just great for 3 or 4 months. Say, okay, we'll stop the study now. But if you look at what happens 6 months later, 12 months later, you get a different picture. So to see a long-term cancer study like this, to me, is very convincing. Next slide, please. Another thing that BioBran does is, in the case where people are getting chemotherapy, it sensitizes the cancer cells to, in this slide, we see daunorubicin, chemotherapeutic agent. And in the next slide, there was another study done with paclitaxel. BioBran increased the susceptibility of 2 different types of cancer cells to paclitaxel over 100-fold. And it works synergistically with paclitaxel, causing DNA damage to the cell, enhancing apoptosis, and inhibiting cell proliferation. So if you're using natural therapies, that's usually what I do with my clients. But if people are doing conventional therapy with chemotherapy or radiation, it's not either or. There's no reason not to use the BioBran. Next slide, please. So let's look at another case here. Here are damaged, broken red blood cells, poor antioxidant protection, poor digestion, intestinal disorder, immune deficiency. You'll find this in Dr. Gerasimus' book. And let's look at the next slide. This patient, after 1 month of treatment, once again, clean blood, no bacterial inclusions, well protected from chemotherapy. Let's look at the next slide. So another thing that the BioBran does is it reduces the side effects of chemotherapy in breast cancer patients. I'm fond of saying there's no such thing as side effects. There are only effects, and these are toxic effects. When you say side effects, you're saying, oh, don't look over here. That's the side effect. These toxic effects are what cause problems with quality of life. Anorexia, vomiting, hair loss, weight loss. And this is, once again, this is a human study. This is with female breast cancer patients who had 6 cycles of chemotherapy. Let's look at the results of using BioBran. Here's what they found. Group A had chemotherapy induced side effects. I'm sorry. You can see here that there's a difference in chemotherapy side effects. That in the chemotherapy group, there was no tiredness or no anorexia in only 12%, but 80% of the BioBran group had no fatigue and no loss of appetite. In nausea and vomiting, only 40% had, whereas 100% had in the untreated with BioBran group. 100% also had hair loss in group B, but only 28% in the group that was getting the BioBran. In terms of weight gain, 64% of women gained weight, 0% gained weight in the control group. Weight loss, there was 0%, but 84% of weight loss in the control group. And 1% required a blood transfusion. In 90%, no blood transfusion was required with the BioBran group. So let's look at the next slide. This is with radiation. So it's also able to reduce the side effects of radiation treatment. And it was to assess the effect of quality of life and side effects. Let's look at the next slide. There are 65 patients in this. and the comparison of the BioBran group and placebo group, nobody died in the BioBran group. 30%, 33% died. 1/3 of the patients in the placebo group died. Only 3% required a blood transfusion in the BioBran group, 52% in the placebo group. Hospital admissions were much lower, 6 versus 63%. No metastasis in the BioBran group, 15% had metastasis in the control group, 12% had infections, 6% had recurrence, but 0% of metastasis or infection or recurrence in the BioBran group. And let's look at the next slide. So here's one more case of before and after with treatment with BioBran. Female, 50 years old, recurrence of breast cancer with lung metastasis. This is pretty serious. Lung metastasis from breast cancer. Deficiencies of superoxide dismutase, glutathione, vitamin C and E, and a fungal invasion, poor immune defense. This is very bad physical condition reflected in the blood work. The next figure shows how this bad situation was reversed. After treatment over a 1-month period, which included RBAC, BioBran, curcumin from turmeric, and an enzyme yeast cell preparation, we see an enormous improvement. And this was once again during chemotherapy, and the patient also felt better. So after 8 months, the patient was still improving, and several lesions of the lung were eliminated. So there is actually a reduction in tumor mass in the lung. Let's look at the next slide. The dosage, 3 grams a day for 1 month and reduced to 1 gram a day. This is during chemotherapy, and even in the lead up to chemotherapy. And for general immune support, 1 gram per day, which would be 2 capsules for those of you that get capsules. I realize I'm going over time. I'm going to try to speed it up a little bit because this next section, next slide please, is really important. It's safe for long-term use because it's very non-toxic, but more important, hyporesponsiveness means that many times, many types of supplements, many types of medications, even prescription drugs, begin to lose their effectiveness because the body makes certain adaptations so that you no longer get the same effect. This is not the case with BioBran. If it got the NK cell activity doubled or tripled within 2 or 3 weeks, which has happened, it'll do it again, or it will keep it up. It won't come down with continued use. So using the BioBran for long term is not only safe, but it maintains its potency. And now the next slide, please. So fermentation is what makes BioBran a superior product to just taking mushrooms, because it breaks them down and gives new chemical compounds that are very small molecules, easily absorbed, and have very powerful immune boosting activity. It's well researched in animal studies, human studies, cell line studies, and it's been researched being used in conjunction with many types of chemotherapy drugs. So it's very safe to recommend this. I'm going to skip down. It's smart, which means that it modulates the immune system and gives it what it needs to do to enhance its function. It's good for cancer patients undergoing treatment, good for elderly people to increase longevity. And the next slide. Okay, this is an important thing that we just have to talk about, because we mentioned blood viscosity as a problem. We mentioned blood clots as being a problem. And I mentioned that blood clots can interfere with all kinds of treatment. It can interfere with chemotherapy. Chemotherapy can make blood clotting worse. And the immune system can't get at NK cells. The immune system can't find the tumors if they're covered up with coagulated blood. And so if you can read this, you can see that the way to improve this is hydration and reducing oxidative stress. This means looking at inflammation and doing the recommended blood test for blood viscosity and using proteolytic enzymes. So let's look at the next slide. Most people who are informed about supplements and about health and that kind of thing have heard about nattokinase, which comes from natto, which is a cultured soybean product. Like miso, it's not as salty as miso is, but it's very rich in enzymes and very rich in probiotics. But most people don't know that there's an active principle inside nattokinase, and that's bacillopeptidase F. It's the active ingredient that's used in NKCP. And so it's just fine to use natto, it's just fine to use nattokinase, but using bacillopeptidase F is using it in its most unadulterated, refined form, its most concentrated form. And I use the NKCP a lot for people who are at risk for heart attacks and strokes, and people who have had heart attacks and strokes have them take it long term. People who have high blood viscosity markers, I also recommend for them to take it long term. Let's look at the next slide. So we can see that it's dose dependent. At the higher dosage levels, the size of blood clots in rats is lower. So you can see the red line there is the highest dose of the NKCP, and that's the most rapid decrease in the blood clots in the rat study. Next slide, please. Here are the effects on blood parameters and body weight. So you can see from this that it tends to lower cholesterol, particularly LDL cholesterol, triglycerides, fibrinogen, and then there's the hemoglobin A1C that I mentioned earlier for glycation. And then there's the high sensitivity C-reactive protein, or HSCRP. It also lowers that. And an unexpected result is that people who are taking it seem to lose weight, which was not an anticipated effect of it. So let's look at the next page for a quick summary. It improves lipid metabolism, which is triglycerides, cholesterol. It improves the hemoglobin A1C, which is a marker for diabetes and prediabetes. It lowers inflammation by lowering the CRP, and it lowers body weight. So these are important reasons to consider this, or at least some type of proteolytic enzyme in the cancer regimen. So next slide, please. Exercise increases metabolic activity. And so that's fake thyroid, but exercise and thyroid and high metabolic activity are necessary for cancer treatments to be able to work effectively. It helps with mood regulation, increases energy, and exercise is anti-inflammatory. Next slide, please. The benefits for cancer patients. It causes muscles to secrete proteins that can suppress tumor growth and even fight cancer cells. So myokines are produced by the muscles, and so by activating the muscles, we increase the myokines, and the myokines themselves have anti-cancer effects. Reducing obesity is important also, and cancer progresses more slowly in patients who exercise, according to, these are human studies, these are not animal studies. And let's look at the next slide, because here's an important thing to consider. Even during chemotherapy, doctors often tell patients with chemotherapy to rest, drink lots of water, get your sleep. But according to a study of 266 patients undergoing chemotherapy for these different types of cancer, took part in a 6-month exercise program and started 3 months before the chemo was scheduled to end. The other half started after chemo was finished. And those that worked out during chemotherapy had a smaller drop in peak oxygen uptake, which is an indicator of overall fitness. and after their chemo was finished. They also saw smaller declines in strength, quality of life, and physical function, and they reported less fatigue. Now, up until the 1970s, the same thing with heart patients. They said, if you have a heart attack or heart problem, rest, take a nap every day, no exercise. But in the 70s, studies showed this is not true. The heart patients who exercised did better, they lived longer, they responded better to treatment. So this is important not only for heart patients, but for cancer patients, even when they're undergoing chemotherapy. And next slide, please. Okay, we're almost finished here. I mentioned emotional healing as being a problem, and I've seen this with patients that if there's old trauma, and it can even be childhood trauma that's unresolved, that hasn't been worked through somehow, with hypnosis, with psychotherapy, it can keep the immune system suppressed. The leading cause of late death following trauma is infection, because the natural killer cell activity goes down with stress and makes the body more susceptible to infection. So that means if the blow on the head didn't kill you, if you didn't bleed to death, 3 or 4 weeks later you may catch a cold and then die of pneumonia after a major trauma. And the immunosuppression can linger for years after the initial trauma. And so when people have trauma, I recommend enzymes, and I recommend BioBran to keep the NK cell activity up. And then the next slide, please. NK cell activity is reduced by stress from natural disasters, nutritional deficiencies, depression. Sympathicaltonia means the adrenal glands are turned on all the time. And so the NK cell activity is reduced by all of these things. And it's been shown again and again that BioBran, RBAC, can increase NK cell activity and perhaps even help reduce stress. And now the next slide, please. Okay, so here it is. There's an increase in NK cell activity measured within 2 weeks. So you have 4 groups before and after treatment, and you can see how dramatic the difference is in a short period of time. I tell patients 6 weeks you'll have an improvement in NK cell activity. I'm not sure everyone gets that within 2 weeks, but within 2 weeks you'll definitely see an improvement in immune competence. And the next slide. This may seem off topic, but I know that a lot of people who are in Europe are aware of this, and in the United States, doctors are becoming increasingly aware of this. We're seeing more and more about it. But a dental focus is it's often a root canal tooth, and so here's dead tissue that's staying in the body, and it often is the tooth's dead, so there's no pain. There's often no swelling, no redness. There's no awareness that this focal infection is there, but the immune system is compromised trying to get rid of it. There is often a smoldering infection in the bone, and I've seen cases where if this isn't taken care of, there's no improvement. And let's look at the next slide. Biological dentistry. You find biological dentists in Germany and Switzerland. There are a few of them in America, Austria. I don't know about other countries in Europe. And there are a growing number of them as the awareness of this is growing. But treating systemic disease by removing toxins like mercury, incompatible dental materials, and removing the tooth and cleansing the tooth socket from failed root canals. This is very important and is very often ignored. Now, this can be the cause of cancer, but usually it's something that just interferes with the healing process. So I think that's just about my last slide. Let's see what's next here. Okay. Cancer is a multi-layered disease with multiple complex networks of interactions located at different levels of the cell, the tissue, and the organs. The focus on the genome, the cancer cells, or even the cancer tissues is too narrow. And in order to better understand the cancer process, we have to have a whole system approach. A lifestyle and supplement regimen that can reduce inflammation, oxidative stress, boost immunity, boost metabolism, and enhance circulation is going to be beneficial in improving outcomes in cancer, regardless of what type of treatment is used. So I think that's the last slide, isn't it? Thank you for your attention. I'm sorry I talked too long, but we'll ask David if there's
presentation. Now let's move on to the Q&A session. If you have any question, please type them into the Q&A box. You may see the Q&A box on your Zoom control panel. Is there any question?
like people are ready to get back to work or go to bed. You know, David, if people have questions later on and want to email you, let people know that you can contact me and we can do that by email later on.
Sure. If you come up with any question later, you can contact me or your sales representative. We're more than happy to answer your questions. And so far, we did not get any questions. So
I'll take that as a compliment.
So
or as a punishment for taking too long to talk.
So maybe we should end the webinar here. But anyway, if you come up with any question later, please contact us.
Okay.
And we and Dr. Kenner are very happy to answer your questions. And once again, thank you everyone for taking your time to join this webinar. And thank you, Doctor, for your excellent presentation. I believe everyone here learned a lot from your presentation.
Oh, thanks for inviting me. It's always a pleasure.
Yeah. Thank you, Doctor, again. We hope to see you. Oh, okay. We got one question.
Okay.
Is intermittent fasting during chemotherapy of deriving the body of essential nutrition needed for healing?
Would you repeat that for me? I did see it in written form. The question is intermittent fasting during chemotherapy?
Yes.
Okay. Well, that's a really interesting question, and I think that there are two ways to look at it. If we're going to encourage exercise during chemotherapy, then we can't have a loss of nutrients. We have to have people eating. So there are two different ways of doing the intermittent fasting, and the way where there's a limited time period, an 8-hour window of eating and then 16 hours away from eating, I think would be the way to do it. During the 8 hours of eating, you could provide the necessary nutrients, and it would be possible to get some exercise. You know, we're not talking about, you know, a 20-kilometer run or that kind of thing, but just getting enough vigorous exercise every day to get out of breath and to use the muscles, you know, maybe some lightweight training. I would recommend doing the intermittent fasting with the long 16-hour periods of not eating, which allows more time for assimilation. It allows more time for digestion to take place, because digestion often slows down, especially during chemotherapy. So I think that if we define intermittent fasting in that way, it's okay. But skipping a day or two of eating would probably not be recommended unless someone is well on the healing path. That would be advanced practice, I think.
Thank you, Doctor, for your answer. And Is there any question? Okay. So, okay. So we'd like to end the webinar here. And thank you, Doctor. Thank you, Doctor, again.
Okay,
And
thank you.
thank you so much. And we hope to see you all again in the near future. Have a great day.
Right.
Thank you, Doctor. Thank you, Doctor.
Okay. Well, I guess I'll leave now unless we need to discuss something else.
Yeah.
So, well, good night to Yasuko and good night to Shirai-san. And thank you for being the host.
Good night, Dr. Kenna.
Good
Thank you
night,
very
Dr.
much.
Kennan.
Thank you,
Okay.
Dr. Kenna.
Thank you so much.
Staying so
Okay.
late. Thank you for staying so late. Great
Oh.
presentation. Thank you
Well,
so
that's so
much.
bad. It's a good thing that Yasuko emailed me that it was 10 o'clock here, not
Yeah.
11. Yasuko's the hero. She saved the day, believe me. I was going to tune in at 10:45. So thank you for the way you stayed in touch with me.
No problem. Thank you, Dr.
Okay.
Kenna.
Thank
All right,
you.
well,
Thank you,
bye-bye,
Dr. Kenna.
everybody.
Okay,
See
bye-bye.
you.
Bye. Have a good
Bye.
night. Have a
Bye.
great
Thank
night.
you.
Bye.
Bye.